Listening is a critical communication skill that goes beyond simply hearing words. It involves active engagement, understanding, and responding appropriately. In healthcare, effective listening improves patient safety, builds trust, enhances teamwork, and fosters empathy. Let's begin with an introduction to listening, understanding the difference between hearing and truly listening. This is a critical skill in healthcare communication. First, we define hearing. Hearing is a passive act. It's simply perceiving sound, and it requires no real effort or attention. By contrast, listening is active. It involves conscious focus, careful interpretation, and an intentional response to what is being heard. In healthcare, this difference matters. Merely hearing a patient's words without listening can cause misunderstandings, missed symptoms, and a lower quality of care. This module includes practical examples. For instance, hearing a patient complain of pain is not enough. Actively listening means understanding the pain's location, its intensity, and how it impacts daily life. That's why listening is so important for patient safety, accuracy, and empathy. In summary, listening goes beyond hearing. It's a mindful skill that improves understanding, strengthens trust, and enhances the quality of patient care. Now let's explore the role of active listening in healthcare. Active listening is more than hearing words. It's the deliberate effort to hear, understand, and respond thoughtfully. Active listening promotes several key benefits. First, it ensures patient safety by helping detect subtle changes and concerns that might otherwise go unnoticed. Second, it builds trust and rapport, making patients feel valued, respected, and truly heard. Third, it supports the collection of accurate information. By listening carefully, healthcare providers gather critical details that are essential for diagnosis and effective care. And finally, active listening strengthens effective teamwork by enhancing communication and collaboration among healthcare providers. This module also highlights the consequences of poor listening, including medical errors and patient dissatisfaction. Through interactive examples, learners will see firsthand how listening can directly impact patient outcomes. In short, active listening is a cornerstone of quality healthcare, protecting safety, building trust, improving accuracy, and strengthening the healthcare team. Next, let's look at the components and behaviors that make listening truly effective. Listening is not just about words. It's shaped by both verbal and nonverbal actions, as well as personal listening styles. We begin with verbal behaviors. These include asking clarifying questions, summarizing what was said, paraphrasing for accuracy, and giving thoughtful feedback. Equally important are nonverbal behaviors, maintaining eye contact, nodding, using appropriate facial expressions, and keeping your body posture open and directed toward the speaker all show genuine engagement. We also consider listening styles. Each person has personal preferences, but adapting your style to fit different situations strengthens communication. This module also introduces barriers to listening, such as distractions, personal biases, and emotional interference. These will be explored in greater detail later. Finally, learners will take part in exercises to identify effective versus ineffective listening behaviors, making these skills more practical and memorable. In summary, combining strong verbal and nonverbal behaviors, adapting your listening style, and being aware of barriers creates the foundation for effective, patient-centered communication. Let's now explore the barriers to listening and, most importantly, how to overcome them. Understanding these obstacles is the first step towards stronger, more effective communication in healthcare. Some barriers are environmental. Noise, interruptions, or an uncomfortable setting can easily distract from the conversation. Others are personal. Prejudices, strong emotions, fatigue, or multitasking all interfere with attentive listening. There are also cultural and language differences. Different communication norms or limited language proficiency can make understanding more difficult. Finally, we must recognize physiological barriers, such as hearing impairments or illnesses that affect concentration. But each of these barriers can be overcome. Creating quiet, private environments helps reduce distractions. Managing emotions and biases consciously allows for clearer focus. Using interpreters or visual aids can bridge cultural and language gaps, and practicing mindfulness and focus techniques strengthens overall listening ability. In summary, while barriers to listening are common, they can be reduced with awareness, practical strategies, and practice, leading to better communication and patient care. let's move on to practical techniques to improve listening skills. These methods help healthcare providers connect with patients more deeply and ensure communication is both accurate and compassionate. One key technique is paraphrasing. This means restating the speaker's message in your own words to confirm understanding. Next, we use summarizing. By briefly capturing the main points, you can ensure accuracy and clarity in the conversation. Another technique is reflective listening. This involves mirroring the patient's emotions and feelings, validating their experience. We also emphasize asking open-ended questions. These encourage detailed responses rather than limiting answers to yes or no. Equally important is avoiding interruptions. Allowing the speaker to finish before responding shows respect and ensures you capture the full message. In addition, use nonverbal encouragement, such as nodding, maintaining eye contact, and using supportive facial expressions to show attentiveness. In summary, paraphrasing, summarizing, reflective listening, open-ended questions, patience, nonverbal encouragement, and practice all combine to strengthen listening skills and enhance patient care. Now let's put everything together by applying listening skills in patient care and team communication. Listening is not just a concept. It's a daily practice with real impact in healthcare. In real-life applications, one of the most important tasks is listening carefully to patient complaints and symptoms. This ensures accurate understanding of their condition. It also means understanding family concerns and cultural contexts, which allows care to be respectful and supportive. Beyond patients and families, listening plays a vital role in teamwork. Collaborating with nurses and other team members during handoffs depends on clear, accurate communication. In short, applying listening in patient care and teamwork transforms communication into action, leading to safer, more compassionate, and more effective healthcare. Let's now explore reflective listening and empathy, two skills that deepen connection and strengthen the caregiver-patient relationship. Reflective listening helps identify underlying emotions and fosters genuine connection by showing patients that they are truly understood. Closely tied to this is empathy, the ability to understand and share another person's feelings without judgment. There are several techniques for applying these skills. One is validating patient feelings, letting them know their emotions are acknowledged and respected. Another is using empathetic statements such as, "That sounds very difficult," which conveys compassion and support. It's also essential to maintain an open and non-judgmental attitude, creating a safe space for honest communication. The benefits of empathy are clear. It reduces patient anxiety, encourages cooperation, and strengthens trust in care providers. Reflective listening and empathy go hand in hand, validating emotions, fostering trust, and improving the overall quality of patient care. Finally, let's focus on assessing and developing your own listening skills. Growth in this area requires self-awareness, reflection, and continual practice. Several tools for self-assessment can help. These include journaling your listening experiences, asking for feedback from peers and supervisors, and setting personal goals to strengthen attention, patience, and responsiveness. To further improve focus, many caregivers use mindfulness and stress reduction techniques. These approaches help reduce distractions and increase presence in conversations. Listening development is also supported through continual learning. Participating in communication workshops and engaging in reflective practice provides new insights and techniques. Finally, learners are encouraged to create an action plan for ongoing skill development, ensuring that listening remains a skill that grows over time. Strong listening skills are foundational to effective healthcare communication. By integrating verbal and nonverbal techniques, overcoming barriers, and practicing empathy, healthcare workers enhance patient safety, trust, and teamwork. This course empowers CNAs and nursing students to become attentive, responsive listeners dedicated to excellence in care.